Well, there might actually be 3 recordings of this if I can record it on Zoom. I don't know. Hello?
Hello.
How's it going?
I'm doing okay. How are you, Martin?
Not too bad.
Good.
Okay, I see that there's a record button there. I don't know. I don't know if I can record. Are you recording?
I'm not recording,
Oh,
but I can if you would.
I
I
think.
can try to if you'd like.
Yeah, I think we should because quality assurance is kind of the issue here. So.
Fair enough. I don't usually record things, so I can.
Yeah, I don't
Yeah,
know where to press. I see a recording
it's
button.
now. It is now recording.
Okay, and send me that later, please. Okay, we only have 20 minutes, so um, I could tell you part of the story in 20 minutes, but I kind of want to know first because you can't get access to my information, which you could have looked up before to kind of reduce our time discussing things. So I kind of want to know what your role is and how, it relates to culture repair or not. You know what I mean?
So, particularly with the patient care quality office, what we do is if you have experienced or anyone has experienced an issue with their care, whether it's good or bad, we can take compliments as well. We do reach out to the appropriate management and ask that they review what happened and the concern that happened. And then we are also able to review health records. When I say I don't have access to things, I do need to have something that I'm looking for. I can't just go into someone's records and start sort of digging around and see what I find. We don't
Yeah, but
really,
there isn't a lot
but
of recent stuff when I mentioned you could do 2024 because I'm kind of new in this area, so there isn't a lot of data. So,
right. But even so I will admit I did go in to our one system, which is Power Chart, but as you said, there wasn't a lot of information. So really there was one test that I was able to see. I'm not able to see the communication from the virtual clinic or HealthELife. That's outside of Northern Health.
Power
Any of
chart
these types
is
of
that
things.
kind of what we see when we go on HealTheLife?
No, it's not.
Okay.
So Power Chart it is very similar. There'd be similar things that are accessible, but it is a different program that is used.
Because I think the first message to you, I'd have to reread it, but I'm kind of hoping that the phone call with the last doctor on the virtual clinic would have been listened to because that was a good thing to start from. Because
Oh,
again,
okay.
because this was another thing that makes me give up on health authorities in BC, so or Canada. So, like you gotta do something about that before I give it a chance again. So, are you able to listen to the recording of a virtual clinic appointment?
I've never tried. I've never had that, and I actually don't know if they are recorded, but I can reach out to find that
I think it
information.
says that they're supposed to be because of for safety or training or for accountability. So I don't know if they do every one and how long they're saved. But if I'm the first person that you receive permission from, yes, please listen to that last doctor I talked to, which was a big waste of time and doing my due diligence for all British Columbians, whether in Northern Health or not is that was a wasted phone call, a totally wasted phone call with an argumentative doctor where we didn't even take one step forward. And at the end, the last thing I said is, please write in your notes that we never interact again. And if they want to know why, they can totally contact me. So that means that's kind of a complaint. So already he should have forwarded that somewhere. That's just one little thing. So I would like for you to listen to that and then you could see what it's like for me because you'll hear me and my voice and this doctor. And then you'll say, hey, Martin, if this was the only thing, you'd be quick to give up on us. But it's not the only thing with Northern Health or other health authorities in Canada. So it's pretty discouraging when I decide after so many traumas to try again to find out, what can explain my digestion issues, for example, right? Or I didn't even get to the part where I've had tests in a couple of different provinces. The really quick one that you're on a table for a few minutes about the heart, and they're like, oh, we want to follow up with this. There's like a weird result on your left side. Well, I've never followed up in like 10 years with this because it just is so discouraging, the incompetence, and also the way I feel disrespected. So again, people have to listen to recordings and do some culture repairing, even if they don't want to hire me as a culture repairer.
So when you talk about cultural repair, like, can I ask, what is it that you're sort of aiming for there? What is it that you're asking about? Because I think that I have a different idea of what cultural repair means than you are. Describing.
First I want to praise you for asking this question. I can't remember anybody who ever has. And at one point when I was talking a little bit about the different choices I'd started making in my life at an eco-village on Vancouver Island, somebody said, it sounds like you're a culture repair. But first, tell me what you believe is culture repair and how you would define it.
So in a lot of ways, when I think of cultural repair, especially in regards to what's happening with Northern Health, I honestly end up thinking about reconciliation and Indigenous rights, etc. And so I'm feeling like it's not quite the same thing that we're talking about, but maybe it is. And I'm sorry if I've made an assumption there. But that's where my sort of thoughts
Alina,
go to.
Your answer is very productive for me, because what if a lot of people in the past might have ignored what I said because they say this guy doesn't look First Nations or Indigenous, right? You're the first person to give me feedback that might mean that when I approach somebody as a culture repair, I have to explain the definition of culture. Well, here's one way to explain it. When a lot of issues has happened recently with Northern Health, and let's say I get a call from Kitimat and they say, oh, you had an appointment, you're not here. And then I explain the different stages I did or the staff didn't do or the system didn't do to cancel that appointment because I did it somewhere else. You hear about all these staff saying, I can't blame you, I understand, thanks. And there's so many things wrong with our system, there's systemic issues. Well, systemic issues, it's either you totally break down that system and you recreate it with accountability and oversight at high levels, or at least at the minimum you have discussions on culture repair because they are systemic issues within communities or micro-communities or cultures or microcultures. So Northern Health, there's a lot of issues and they are solvable issues. And there are people get paid big salaries like ministers of these things that actually should be working on them. But again, if people won't even admit their systemic issues because it's all about selling a false image, that if you do a survey that's anonymous with 99% of their staff, they're going to say that's not what it's like, then I don't want to be the one that is told that I have mental illness because I'm different from the norm, not accepting culture breakages and participating in them. I'd prefer avoiding medical systems to just be a person who's launders money back and forth without any productive human thinking tools being used for culture repair. It's not just about me, it's about everybody else. That's why I say culture repair.
Fair enough. And I can see that and see what you're talking about, kind of more big picture kind of situation rather than individualized.
Yeah, that's the thing is, like right now I put on my Facebook, I said for me it was November 3rd, 2023, where if people on their, let's say, social media don't state it's not okay what's happening in Gaza, right, all the innocent people dying, if it's not okay after that date, I said anybody like a judge, a politician, a police officer, even my relatives, if you can't prove that before that date you didn't say that's not okay, publicly, transparently as what you stand for, you're not selling an image, or you're not avoiding what's happening in the world that has an impact on all of our humanity, then yes, it's hard to take people seriously as not being developmentally disabled. So if I see these people as developmentally disabled, and somehow there's something wrong with me for questioning what they're not fixing as I seek medical care from them, again, the evidence is there about who is unhealthy, right? I'm not going to go with unhealthy cultures and then entrust my health in them.
Yeah. So I understand that I'm going to move back to our kind of questions. So again, with the Patient Care Quality Office, I'm not able to just kind of spread out a wide net and try and find concerns. That is not something I'm able to do. But I'm happy to listen to if there is a recording, which I can find out if there is, and if there is, I can try and access that. My other thing, though, is it would be helpful if you did list, sorry, I do have your email here just so that I had an idea. Originally, you said that it was HealthELife, communication between our online platforms and the locations they service, as well as the virtual clinic services. And so with this, like, that is a number of different services, admittedly, mostly through Northern Health. But what are the issues that you're kind of experiencing? What is it that I'm trying to kind of look into?
And I consider myself a systems thinker, and I've had people with Harvard University training also consider me a systems thinker. So, of course, there's interconnection. So, of course, it is a wide thing. You can't do culture repair without the wide thing. But if you want to focus on one thing and start from there, whether you get access to that recording or not, just letting me know if you could or could not get access, because that's a bad sign right there. How are you supposed to improve things or talk to the right people about the right things in the right way, providing them an example of what was right or wrong without that? And the other thing is that in that recording, if you can't get it, one thing I ask is, why can't I see online the results of this? And then he said, yeah, it's weird. I can't see it either. And I'm going to talk to a friend of mine I know at that department why we can't see these results. And these were, I think, part of my blood tests related to hepatitis. And again, 1 or 2 days ago, which is, I think we're looking at almost a month now since those tests and since they were supposed to show up online before that appointment, is I can't see them still. So it says see comment, and then I can't see them. And then I ask him, and he can't see, and he says they haven't been done or they've been sent somewhere else. Do you know what happened to me when I returned to Canada from volunteering in Uganda and still having one suitcase there and actually wanting to go back, but I was just visiting relatives in Quebec? Yeah, I'm looking at the time too, 12 minutes. I go back to Quebec and I don't have a doctor, so I go to the local hospital emergency super early in the morning. I was the first one, so there was just to renew a medicine I've been on for a super long time, okay? Now I'm answering questions honestly, and then suddenly I'm taken to the psychiatric ward because I'm unorthodox, uncommon, out of the norm. There must be some psychiatric issues with this guy. Now, in the meantime, I have my laptop that can prove everything I'm talking about. Like, for example, having worked with a monkey in South Korea and saying, I wouldn't mind getting a blood test that tests for this. And that's just a few other things I said. But here I said, if you can't do that, because I'd pre-written a letter in French saying, this is what I'm here for today. If I can just get at least renewed my medicine and a couple other things. The rest I was willing to let go. But being prepared, being diligent, advocating for myself, I ended up in the psychiatric ward. Now, of course, I asked these 2 psychiatrists that evaluated me, and I was out the next day. But the thing is I felt violated. And I felt like my health was threatened because they said I'm lucky to be in a room, to get a room in that upper stairs, because I was somewhere else downstairs, and I did the work with them when somebody had a crisis. I calmed that lady down, and they had the staff lock themselves in their office while I'm there calming her down because I created rapport I know I have training in mental health and counseling and psychology, and and it was actually the security guards that were the best to come, and I helped her agree to go into that room to calm down. They locked her up in a room a little bit to calm down. But in the meantime, no care and concern for me. And then they put me upstairs in the same day. And then they said I'm lucky to be in a room with a guy who's super nice, but he's got a sleep disorder where he's snoring all night. And I'm not even allowed to have a pen to take notes. I'm not allowed to walk in the hallway. So that means my sleep is compromised. I've been kidnapped for what I believe might be Quebec charging my BC health card, and I never got answer what was charged, if anything. And when I go to take them to court, the court they don't even know what to do with this, so they keep avoiding me, and it's been years. The court's avoiding me. Like I should have been in Uganda just volunteering for people that appreciate. I got 3 post-secondary degrees, and I tell you, I feel Canada is no more of a developed country compared to, Vietnam where I've been. And, there was mosquitoes that bit me in different countries. I don't mind getting tested for things when I come back. And that's my due diligence. I don't want to bring a disease here, but they think my disease is a psychiatric disorder. That's how incompetent it is. And doctors are like, you don't challenge these elites, because what if they don't want to see us anymore? Even if they see us, they don't seem to even care to do work as doctors. So yes, so that's systemic issues. So please, Alina, thank you. I think you're listening, and you're your arms are crossed, but you're kind of leaning forward, and you're kind of looking at me, and it's like, yeah, this guy's different. And I think it's hard to take the reality of what he's talking about, because probably you kind of know, right? You kind of know that there's systemic issues, and people think, oh, it's here, Northern Health. No, I've been everywhere. It's everywhere. So there's no grass is greener syndrome that you should suffer from. You're going to be very disappointed. Don't go somewhere else and find out. You might even get a doctor that's even worse over there by random. And they say, if you don't take that doctor, you're lucky to get him, then you won't get one again. It's that silly. And I did talk about issues to solve this. For example, don't have doctors in both public and private sector. You can't have both. Choose one. You're either a capitalist or you're a healer. Don't benefit from both, because then you're going to complain, oh, we don't have time to see patients. We have too much administrative stuff to maximize our profits. No, that's, separate. And then admit that you have to train new people, even people that wouldn't necessarily succeed at being admitted at university, but the province is going to pay for free tutoring for them. These are solvable things I've been mentioning for years. And COVID was a social pandemic. It was a real virus, but it wasn't that deadly. It was a second flu during a flu season kind of thing, right? And really the social pandemic, as it was overflowing strain systems, like some of the harder flus have had in the last few years, right? You can see, whoa, our system's barely keeping up. That's the pandemic. Don't wait for like a virus that kills 30% of people to show up before you solve these. And again, I don't see them being solved. So that's why am I wasting my time in Canada as a culture repair? When people want to point the finger at Trudeau, he wasn't even born when some of these things started. We have to start talking about culture repair. Please look into why those blood tests weren't there, and why I was stuck with that doctor, and why I should not have my care card. And then you're going to say, well, you don't have to pay. It's on your care card. I'm a responsible citizen. That's not okay that the collective insurance was charged for such an incompetent appointment that I changed my life to be able to meet on time, right? And it's not easy, because we don't have precise times, like they're being paid, but we have to be available all this time, and you think they're doing their homework. When I had my driving school, I would read my notes from the student before the student. And I even said, hey, thanks for the feedback last time. And if I don't apply it when you see me, I give you the opportunity to criticize me and give me feedback, because that's my job, to get you your money's worth in the time that you're paying for. Well, collective insurance and Blue Cross is like, man, it's like, I would say about 60% of the income is lost in Blue Cross type systems. There's so much corruption in there. Again, the government has to look into that. There's a lot of money laundered in these systems that aren't efficient, and eventually is lost, right? Use it instead to train new students to become doctors without student loans. If you care about people, don't make them the kind of doctor. I had a young doctor in Castlegar, yes, we got less than a minute, who asked me how much cash I had in my wallet at the emergency in Castlegar just to renew my medicine. And he got all the $50 cash I had, and I'm poor. And that's the norm. That's the norm of what he's starting his career in. That's not okay for me. Alina, do you have anything else to say? Because we're at the 20 minutes.
I don't at the moment. I do need to go and see what I can find, and I will get back to you with if I'm able to access or how it is. It is something that I do have to reach out to other people, so I am a little dependent on others responding to me. So I can't guarantee I'll get back to you by the end of the week, but hopefully I'll be able to let you know at least that I've been able to access it or not by the end of next week.
You know what's funny that you can do with your email is when you send your first nice request to these people, is you can put in brackets, this is the nice cop. And when they don't answer, you be a bit more firm, and now you're getting the bad cop.
I'll do my best.
Okay, thank you very much. Okay, and send me emails of anything else you might want, and if you need permission. Go ahead, what are you saying?
I just wanted to, if you wouldn't mind just letting me know your birthday, just so that when I am sending things, I can make sure that I have the right person that I'm looking for. I actually gave it to you in a. Was it June?
Well, don't say it. Don't say it if we're recording. But the thing is I gave it to you as a way to kind of just look up the year of that song, and that'll be the year, and you got the date and the month. It's just to protect a little bit when you put the. Plus, it's me singing a song, so you had a face that you know this is me. And also, if you look up the year of release of that song, that's the year. It's just to kind of minimize a little bit private information. It's like asking you to tell me how many fire hydrants are there, or bridges, or bicycles, or motorcycles.
Fair enough. Fair enough.
Okay.
Okay.
Thank you very
Sounds
much.
Good.
Okay. Have a good one.
Thank you.
Bye-bye.
Bye.
Oh, I definitely spoke more, but I believe that she did not have a lot of things to offer herself in the sense of preparation or things like that. And also, these are things that are valid that I'm saying, and I need to explain it to everybody, not just to her, everybody that's going to see it on Captain Accountability here. And this is what I'm stuck with. I'm stuck with living with a species that as a majority gets paid to facilitate the Anthropocene, pretty much it. And it's pretty sad, and I don't like being judged by a primate species that had the same potential to develop human thinking tools and behaviors of sentience and sapience as I have. Okay, and I worked hard because, yes, I was born at a time when I could not really find Homo sapiens.